Inside Vision is brought to you by New England College of Optometry and Sector Media Group.
Back here. And then we're going to walk.
Hello and welcome to another episode of Inside Vision. This week, facing the challenge, the road to reopening. We have another great show for you today and some really great guests we'll be introducing in just a moment. We have Sue Downs, the CEO and co-founder of My Eye Doctor. We have Dr. ARTIS BEATTY, CMO, Chief Medical Officer of My Eye Doctor, and my good friend, Dr. Jeff KEGARISE, who's the President and CEO of Center for Professional Development, as well as the President of Cool Springs Eye Care. These guys have so much great information to share. They've been working in the trenches every day, trying to really build that road back. And, you know, there's a couple interesting things we know. We know right now 47 states out there have begun to open and having some staged reopening. And optometry is a critical part of that across the country. Also, what we know is about 2/3 of patients say, when it comes to healthcare, they're ready to go back. They appreciate that people are preparing appropriately, practitioners, office staff, but about 1/3 are really still questioning whether this is the right thing and whether they're safe. As a result, it makes it so critical that each of us are taking every step we can to make our patients feel comfortable, particularly at the beginning. And we have some great examples of that today. And in fact, just listening and traveling around the country, and Eric, my co-host, and you're going to hear from him in just a moment, has been traveling the country, talking to people and seeing what's really going on out there. And I will tell you my own personal experience. I visited our clinic yesterday, and I couldn't be any more proud of our team and these painstaking efforts they're taking, not only to keep patients safe and minimize risk, but also for our staff and our doctors. And you're going to see a lot of that today. So, Eric, I know you're out in Pembroke Pines with our old friend Bob Davis in his practice. Really curious. You spent some time out in Georgia the past few days, now in Florida. What are you seeing, Eric? What differences are you seeing? And we look forward to hearing from you throughout the show today.
Yeah, Howard, it's really incredible. I can't wait to see what you guys do at the New England College of Optometry with coming back, because it's really a challenge. And now we've seen it in Georgia, we're seeing it in Florida. I was over on the other coast for the last 4 days on the west coast of Florida in Naples. And we drove by 4 or 5 practices trying to see what kind of action there was, patients coming through or not. And there's very, very little activity over there. A world difference than what's happening in Valdosta, Georgia, where we were a week ago today. But I want to show you a little bit of a look around this practice here today. Take a look off into the optical. Right now, nobody here. Half an hour ago, patients were coming through. Everybody has to have their temperature checked at the door and then hand sanitized and in and out. Every time we come in and out to get set up for this broadcast, I'm sorry, I'm a little bit out of breath. We were kind of hustling, but come back this way and you'll see Katie. Katie, it's nice to meet you. I'm Eric, and we've got our audience of eye care professionals out there. Can you tell us what it's been like for you so far?
It's been good to be back to work. And
when did you come back to work?
we started last Monday.
Okay, and tell me a little bit about the patient flow and what you're doing. Maybe you can show me something about the hands.
So when they come in, they're supposed to call us over the phone to let us know that they're here. Then
yep, somebody's at the door right now. You can go ahead and get them. Take care of them first. Okay. Guys, I can't hear you right now, so we're just going to listen to what Katie's doing as she lets a patient in here. And now I will be able to hear you. Dominic, over here. Oh, it's not a patient, it's a delivery. See, the door is locked, and they have to keep it locked and wait for patients to come up. They have to have a mask. And now Katie's going to show us what they do for every patient coming in. This is just a delivery. This is hard to do. So I'll get over here, Katie. If you just kind of would demonstrate for me exactly how you handle an incoming patient. I'll put the mic down for a second.
Check the temperature. 97.1.
97.1?
And make sure that the temperature is good.
That's good news, because I didn't know my temperature.
Then I'll do hand sanitizer. And then after that,
what's the best technique for this? Because I've never done this at a medical office before. What's
I think they say, what is that? The fingers.
All the grooves?
Yeah, rub both sides.
Okay. And what else you got?
And then you're gonna do this, and your index finger.
Eric, Eric, can you ask Katie for us? Does she feel safe with the
I do have Katie. Oh, Katie here. Yeah, see, I have my plugs out. Okay, yeah, let's hear a little bit more about that.
So this is to check the oxygen level, because the coronavirus affects the lungs. So right now it's at 94. Anything over 90 is good.
And we're in good shape. This is actually really valuable to me, having been. I'm going to put my earpiece back in so I can hear you guys.
Eric, can you hear us?
No, I can't hear you. I can hear you just very distantly, Howard. So let's get over to Bob for 1 second. Dr. Davis. When I get my earpiece back in, I'll have Howard. Now I got you guys.
All right, good. We were curious to ask Katie, and you can ask Dr. Davis as well, how they feel in the office. Do they feel comfortable? Do they feel safe? What are they doing to assure not only just the patients feel comfortable there, but the doctors and staff as well?
Yeah, Howard is asking about the way that you help patients feel comfortable and staff comfortable at the same time. Tell us about all these preparations.
Well, as you can see, we only let one patient in every half hour now. Usually we have 4 doctors here at least and see patients every 15 minutes. So it's a big change. We want to make patients feel safe, so everyone wears a mask. When we're seeing patients, we wear face shields. It's tough because, what we do as optometrists is communicate through smiling. They can't see us smile now, so we have to talk slower. We have to be a little bit more prepared beforehand. So we send out forms for them to fill out so we don't have to go through the front desk. The technician will take the patient back right to pre-testing, do all the tests necessary, bring them into the exam room. The patient sits in very few areas, touches very little. It's just a new normal, brand new normal here. But our patients feel safe. They appreciate what we're doing. We've had just very positive feedback from our patients and our staff.
Well, this is the most highly protected office that I've seen so far in my travels in the last 10 days, coming down the East Coast from New Jersey and through Valdosta, Georgia, and then into the Naples area. Show us more, just if we could take a look. And then I'm going to get back to... Yeah, please. Howard, are we still okay there?
Yeah, we're still great. I'm, curious to ask Bob or Dr. Davis how his patients have reacted and whether they seem to be comfortable with how he's set things up there.
Okay, great. I'll pass that along. Stand by.
Every exam room is sanitized before the patient comes in. We actually have a sign here, so when the patient walks in, they see this sign and they realize what we're doing to protect the patient. Again, the patient is sitting in the chair. We have a technician with us. I never touch any equipment as far as computers and all. We have a technician that's with us at all time doing that. We have the history in advance. We have everything we need in advance, so the communication is as little as possible, and they understand that. Again, I'll be wearing a face shield and a mask at all times. When we're finished with the examination, we call an optician to come into the room and we hand off to the optician. So the patient is never left alone. The patient is always with somebody. And we can walk into the optical and I can show you exactly how we're protecting the patient when they select eyewear.
Yeah, we'll get to that at another part of the show a little bit later when our guests come on. I hope you'll stay with me so that they can ask questions too. Howard is asking what the patient reaction is like when they come in. What are they saying? Especially, it must be really hard for the elderly to hear. I mean, I can barely hear everybody, not to mention, through these masks and the plastic.
Right. Well, again, sure, we have to speak up. We have to speak more slowly. We have to repeat ourselves. These are all the things that we have to remember to do so that we can communicate effectively with our patients. Patients are very excited about being here. They really feel comfortable about all the protective measures we're using to make them feel comfortable. So it's been all positive so far. We've had nobody feel uncomfortable as far as I know.
Sounds good. Hey, Howard, I'm sure our guests are going to have questions for Dr. Bob as well. Why don't you go ahead and introduce them if that's still on cue?
Yeah, no, we're ready to
I'll
go.
find another place that Dr. Davis can show us around while you do that.
Thank you very much to Eric out in the field and to Dr. Davis for allowing us to come into your office and see how things are going out there. So appreciate it. So we have some, as I mentioned, some great guests that are going to share with us some of their experiences. And we're going to start off with Sue Downs. Sue, great to see you. Thank you for joining Inside Vision, and thank you for all the great work you continue to do out there. I know that you and my eye doctor have been very busy out in the field with your over 600 locations that you have, and I think people will be very curious to know kind of how you've managed things. How have you managed through this and dealing with the roadblocks that you face ahead of you? I think people would be very interested in knowing, and we'd like to know. So please share with us a little bit about what's happening at My Eye Doctor.
Absolutely. Good morning, Howard. It's nice to see everybody. I say to my organization every day, this has been the hardest point of my career ever, and for all of us, and I hope we never have to go through it again. I think it was unbelievable what it was like to shut a business down. We've been great at buying new practices, opening new offices, shutting them down was really unbelievable. And then now, after we got everything secured, we've really focused on the training aspect. So a lot of the things that you just saw at Bob's office, we were focused on from the very beginning, before we even shut our first store down. How do we secure the path for both our associates, our patients, I'm still getting a lot of background.
Yeah, I think we are getting a little background sound. We'll have to ask our technical people to take a look at that. We're still kind of hearing what's going on at Dr. Davis's office. But Sue, we were able to hear you, and I think the preparation and planning is obviously very significant for you. Can you talk a little bit about how you structured it in a larger group? I know you want to get consistency, and I think that's what patients want to see, is that consistency. But how are you guys doing that across such a large group?
Right. So, and Dr. Beatty joined us this morning too, so he can talk to you from the clinical aspect. But we really started with what we needed in that patient journey, where each touch point was for our associates and our patients, and how do we make it the most secured and healthy environment that we can. We developed very strict protocols, safety and health protocols, which we stood up in a training module process. Every associate, both forward-facing to patients and non, has gone through that training. In fact, we are opening up another 180 offices this afternoon, Howard. And so everybody was invited back on Monday, and they've actually spent the last 8 hours going through all those training modules to be fully educated and understand, and to continually increase the awareness. And then on top of that, we've really had to, you asked the question to Bob, like, how are patients feeling? We've really had to make sure we're over communicating to our patients how we are handling their patient care, how important and vital it is to us, and how we're making sure we can provide them as safe of an environment as possible during these times.
Right, and that education component is so critical. So it's mandated they cannot come back into work, would that be staff and practitioners, until they take these courses or this course in order to be prepared? Is that how you do it? And then second part of the question, if you don't mind, did you guys create your own education? Did you borrow that from somewhere? What are you using to do that education?
Yes, so correct. Everyone has to take it. It's mandatory before you can see any patients, before you can enter a clinic. And again, our leadership team, including myself, we've all gone through the training as well to make sure we support the frontline folks that are in our organization. And we did create all of the training materials ourselves. We have a great leadership team of doctors who, again, they started before we shut our doors down to patient care. They started understanding the mapping of the patient journey and all the protocols we needed to put in place. And then they've been able to, they actually went in and demonstrated patient care before we started opening up to make sure, and we learned things we had forgotten. And so they went through those touch points with the patient again. And we opened up, 57 offices our first week, which is now in our third week of being open. And we learned a lot. We learned a lot of things we just hadn't thought about. Bob's talking about keeping with the patients. We don't allow them to bring a person in the office with them unless it's, a child. We make sure they understand if they're going to bring their purse with them, it's got to stay with them at all times. It's got to be on their lap. It can't be put down. I mean, just every single thing. I don't think we can be too careful during this time.
Absolutely. And your staff themselves, they are, wearing, it looked like, at Bob's office, there's shields, there's masks, there's gowns, et cetera. And maybe ARTIS can talk about this. Dr. Beatty, we appreciate you being here with us as well. Chief Medical Officer for My Eye Doctor. We're hearing a little bit from Sue about some of the efforts you guys are making. Could you talk a little specifics? We've seen a little bit about what's going on at Dr. Davis's office. How are you guys making sure that your teams are safe and prepared? And also like to understand from you, Dr. ARTIS, how are Dr. Beatty, sorry, how are people feeling in terms of coming back to work? Have they been enthusiastic about it? Are they a little nervous about it? So if you could try to address a couple of those, that'd be great. I think that would be very helpful for our audience.
Yeah, as Sue mentioned, thanks Howard for having us, but as Sue mentioned, we went through the painstaking process of creating protocols based on information that we were gathering from a number of sources. So we looked at guidelines from the CDC. We looked at what the AOA was thinking. We looked at what was happening from the Academy of Ophthalmology. And we put together these protocols that really addressed patient safety, what we should be thinking about when a patient comes into the office, and the safety of the staff and doctors, what they need to know in order to make sure that they're providing an environment that's safe, but also that they can feel comfortable. And so we, just like Dr. Davis, we're taking temperatures on everybody as they come into the office. Staff is wearing a mask, they're wearing gloves. We're actually doing double mask protocol, meaning we are masking all of our patients as they come into the offices as well. And so right now we're making sure that they have a 3-ply surgical mask as they come in at minimum. And so it helps to make sure that we are slowing down, reducing the risk of spreading the virus. You know, we've talked a little bit before about it's maybe not possible to mitigate all risk, but we can certainly minimize it that way. And that goes a long way for as far as the staff feeling comfortable. And that's a big step whenever you're bringing patients in, right? If you can be confident that you're providing a healthy and safe environment, that confidence comes through to those patients, and their expectation is, you've welcomed me in, you've got to take really good care of me while I'm here, right? And so, you know, we went through a lot of different steps in the process. And as Sue mentioned, there's a lot of things you don't realize or think about in the office until you run it yourself. And so part of making sure that we were satisfied with the protocols was taking the clinical leadership team, myself included, putting us in a clinic, running through some patients there, making sure we're making those proper adaptations. And as we've graduated from being only essential care to being able to do some routine care in a lot of the states in which we operate, then you start to think about other ways to make sure your frame boards are sanitized, to make sure that you have a way of taking adjustments or taking measurements differently, repairing frames differently. How do you set up your social distancing in the office for people who may be wanting to come back and pick up product? And all those things continue to evolve. You know, the question about the staff and whether or not they feel comfortable, it goes back to that preparation. You know, when they get the phone call that my office is opening and I'm coming back to work, the list of questions always starts with, will I have PPE? How do I use it? And how do I make sure everybody else is using PPE properly? And that's where having that training set up for them and giving them the opportunity without patients in the office to actually understand what to do and how to use it is so important. And it goes from people who are tentative to people who are now enthusiastic about saying, I can do this, I can provide the function, and I don't have to worry about my safety to do so.
Wow, that's terrific. You know, I think we're all becoming experts on PPE and social distancing. We're going to kick it back over to you, Eric. I see you there with Dr. Davis. Just curious, we're looking at, looks like a reception area of some sort. How are you guys doing the social distancing and looking at making sure PPE is appropriate, not only just for your staff, but also for patients?
How are we doing social distancing here, and how is it safe for the patients? How are you gathering it? How costly is it? Can you expect it to keep coming? What's the situation on PPEs for patients and staff?
Well, we've been fortunate enough to have enough PPE materials to keep our patients safe. The things we're doing here, as you can see, we have the chairs taped off so people are at least 6 feet away from each other. We have an X on the floor here, so we make sure the patients stand over here and don't go close to there. to the door while there's another patient there. So we're doing everything we can to make our patients safe, our staff safe. One thing I did, which I think is very important, is before we opened, we actually had all our staff tested to make sure nobody was positive. That made our staff feel better, and of course our patients safer. So that was one of the things that I elected to do before I opened my doors.
Thanks very much. Howard, what else do you have? Actually, maybe you could get some reaction from the guests on that while I replug in my earpiece.
You got it. Thank you. We're going to kick it over to Dr. Jeff KEGARISE in Nashville, Tennessee. Jeff, thanks for joining us. We appreciate you being here. You know, it caught my eye, Jeff, when I saw a video that you put together for your patients. I thought it was just outstanding. I think in the realm of what we've been talking about and trying to make people feel more comfortable coming to the office, what have you guys learned at Cool Springs and some of your other locations that could be helpful to others, as I know you've been a little bit out in front of the curve on this one?
Well, I certainly continue to learn from experts like you have here, and learning from Bob and seeing kind of those adjustments. But I think I won't reiterate all the things that everybody's mentioned, but not only doing things, designing things, tweaking things, but then communicating very consistently to patients that, hey, this is what you should expect. This is the way we're doing it now. This may not be the way we're doing it in a week. It may change. And trying to find multiple channels to communicate with. I think that probably one of the most important things on the patient side is just not going from going from full-time care to emergency care and gradually opening and having this no information in between. It's got to be constant communication through e-blast, through the website, through social media. We've added podcasts, and then the videos. The videos have been helpful because they have more longevity. Not only can we say, hey, look on Instagram or look on Facebook or look on the website for this video, but it allows the staff now, when we're having people come back, to say, let me link you to the video so you will see how care is. Anytime, and I think maybe ARTIS mentioned it too, something about, you know, taking care of or communicating to patients before they come in. Bob said he was doing the histories that way. We toyed with that. We haven't been able to really make that work logistically yet, but anytime you can do more on the front end, it will minimize the time in the office. And so communicating to patients, having them not just be walking up to the door, knocking, going, hey, it's my time for my appointment, knowing that they've watched the video and said, oh, I'm going to stay in my car, call your office, you're going to come out, do this, I think has been very, very helpful. We've really seen over the last 2 weeks more adoption of those methods.
Two questions, Jeff. So one, are you sending the video out when they make the appointment so they can see that, number one? And part two to that, can you tell people about what you're doing in the parking lot? I think it's kind of an interesting approach, and perhaps even gives your patients an even greater feeling of minimizing risk.
Sure. We toyed with the idea of just having that as a link and automatically sending that to patients. I don't think the front office has chosen to do that. I think they've chosen instead to do that verbally over the phone and say, because they felt like that was more effective in trialing it out for us. So they say, here's the link, I'm going to give you this, I want you to go see this so that you know what to do when you arrive. As for the arrival and the parking lot, you know, our marketing director, Cole, put some great signs up in the parking lot with, you know, Snellen charts that say we are open, so people know that. But we're greeting people at their car. We've got designated places, much like at a drive-in, you know, restaurant, that say, you know, parking spot 1, 2, 3, 4, 5. Tell us where you are, which spot. The good news is that's worked very, very well. Occasionally, two people will drive up in a gray Lexus, and we go, I'm taking both out. So those are the practical realities. So I mean, that we're providing them their forms there. Our staff is masked and I think sometimes gloved, although that, I will tell you, the whole issue of starting with gloves, and now here in Tennessee, we don't have everybody gloved when we're doing some of these things. Obviously, we're keeping our own pens and all the paperwork, and anything that the patient touches is either given to them or sterilized. But I see people becoming a little bit more comfortable. That's kind of a dangerous position because you don't want people to get too comfortable. We have to maintain the safety for them and for our staff, so we've not relaxed standards. But I think by human nature, there are going to be some of these things that we go, kind of like HIPAA. Oh, we can't do this. And then it's like, well, you know, there's a practical side of getting this accomplished. And that's kind of what we're seeing with people showing up in the parking lot for their exams.
Fantastic. So ARTIS, could you speak to communication-wise? Obviously, that seems to be such a big issue. What are you guys doing at My Eye Doctor in terms of communicating with patients, letting them know the painstaking efforts you're making to minimize their risk?
Yeah, I think communication is key, and it had to start before the practices discontinued inpatient or scheduled in-person care. I think we spent time communicating with our patients prior to the discontinuation that that things were changing, that we needed to make sure that they were going to be safe. They worried about their product that they had left. They worried about their follow-up visits. We wanted to communicate that ahead of time. Then during the pause, we wanted to keep them updated. This is when we plan on opening. This is where your product might be. This is when I want to reschedule your visit. And then as we started to open, we communicated with them that these are our protocols. These are the things that you want to do before you get here. I think Dr. KEGARISE makes a great point. We have a communication center that helps us answer our phones. That's great when you have a large footprint. But when you're dealing with patients in individual practices where you want them to be able to communicate directly with that office, we had to come up with ways to give them a different number when we confirmed their appointment, so it would ring directly in the office. So then we could meet them at the door when it was time for their appointment and bring them in. And I think that the more you let patients know that things are different, but this is the way they are and this is what you can anticipate, the easier it is for them, right? I think that's equally important for our staff, because I think we sometimes forget that even though our staff is involved in healthcare, they're healthcare providers, they have some of the same fears and some of the same misunderstandings, and they have to be communicated with the same way. So we spent a lot of time communicating with our associates before, during, and after the pause, so they would understand all the things that were changing and being completely transparent about where things were going to go and what those expectations should be whenever they return to work.
Wow, fantastic. Thank you very much. Sue, maybe this is a good one for you, but I'd really like to ask all three of you, and even Dr. Davis, what are you looking at in terms of volume? I mean, I know you guys, Sue, you guys have been open a little bit longer. I think Bob's just getting started. I think, Jeff, you've been open for a little bit too. Can you give us any idea? Are you seeing a ramp up? Is it what you expected? Sort of percentage-wise, can you share with us what you're seeing in terms of volume, perhaps compared to a pre-COVID time? And is it continuing to ramp up?
Yeah, so we talked a little bit about it before we came on, Howard, right? What is the new volume? Because if you listen to everything our great doctors have said this morning, there's a lot that goes into seeing a patient. I think Bob referenced that he had 4 doctors seeing a patient every 15 minutes, and now he has 1 doctor seeing, a patient every 30 minutes. So our volume's really been cut by 50% at this point. It depends on the state too and where they're at with both essential and routine care. And I would say that we're continuing to build momentum. The key ingredient, I think, to this, which you've got to have technology and you've got to have data. You have to understand your patients. I can say, listening to all of you this morning, I was a patient last week. I have asthma, as many of you know, that are my friends. And so I had to go in for my monthly asthma shots. It was a relatively simple process, and I could really put my mindset into what our patients were going through. And it's like going to the grocery store. I mean, going to the grocery store the first time during COVID was a new experience for us. But now we've come to understand it, and it's more acceptable to us. We just have to continually be guarded to make sure we are doing the best for ourselves and for others that are in our lives and that we're exposed to.
No, it makes sense. And and Jeff, on your side in Nashville, what are you seeing? How long have you been open, if you wouldn't mind reminding us? And what are you seeing in terms of volume?
Yeah, I think for all the practitioners in general, you're going through this evolutionary phase of emergency only, and then emergency plus urgency. And that urgency is kind of that variable of, is that a medical urgency or is that a patient urgency? My insurance is running out in 2 days, and they get adamant. And, so you start to kind of say, okay, how can we do that safely? The variables, though, are the hours that the office is open. So we moved at the beginning from 10 to 2 to 9 to 3, and then now 9 to 4. How many staff do you need for the anticipated patient flow? How many doctors at a reduced rate? How much of that doctor care are telehealth versus in-office care? And I think that's a really, really important thing. We can talk about it later, but the out-of-office care is you can't just talk only about the systems in office. The systems out of the office to take care of your community population are huge. So we've now ramped up over this evolutionary period, and I can only imagine what ARTIS and Sue are going through with all the offices, because it's so variable from office to office. This is like diffusion of innovation. Some people are more willing to try, and others are going to wait till everybody else has proven that this is really effective, and then they're comfortable. And that's okay. That's just human nature. We joined the Kepler system at the end of February, and they've been tremendously supportive because they recognize that this is not a one-size-fits-all. It's a very local decision, and they've supported us with what is right for you guys. What first makes you safe? That's what we're saying to our staff and our patients. But then secondly, how can you ramp up and start to take care of patients? And so we're managing like we always do, and that is we're looking at our access. How accessible are we to patients? It's not just what we're feeling. If I'm a patient out there, can I get in to see you? Because their expectation is that you may change your systems, but I still want the same type of care you gave me before. And that was, you really worked on not me and me not having to wait for weeks to get in. So we look at like always, the time to third available appointment in our access scheduling. And that is dictating a little bit of how much we ramp up. We're now in our larger office at 2 doctors, each seeing 3 patients an hour. And in our smaller office, we're at 1 doctor. We're moving from 2 to 3 patients an hour. And so it's a little variable depending upon how we've developed the system. And like Sue said, we have one element of technology in this larger office that really helps facilitate some of our in-office flow. That gives us more capacity to be able to do some of the things.
That sounds great.
Howard, I just want to give it kind of as a reference. We started with 57 offices, and that communication piece, telling the patients how we're handling the health and safety, but then getting them back in. You started the show with saying that 2/3 of patients are comfortable. The demand is still there, and their needs are even greater during this time because they've experienced, we're all on a digital technology right now. They've experienced a lot of digital strain and a lot of other things, along with losing breaking glasses, eye infections, like the gamut of everything. So, if you take our first 57 offices, we opened another 114 a week ago, and today we'll be opening another 180 offices. So obviously we're looking at the demand, and Jeff, to you start at one point and you continually build, right? Making sure you're adhering to the safety and health protocols. But we're secure in knowing that the patient demand is really there. Otherwise, we wouldn't be opening up as many more offices. And next week, our plan is to open another 200 plus offices. So our patients, for the whole industry, our patients really, really need us. That's why we're here. But I would also tell us that we can't just look at the volume of the patients that we're seeing. The dynamics of our financials have changed. So I would make sure that we're all mindful of understanding what our bottom line is too. That's facts, guys. Like, it's not just about taking care of patients. We have to take care of our businesses, because if we don't take care of our businesses, we can't take care of our patients, and we can't take care of our associates. And so, what is that going to look like in 3 months from now when you've really decreased your volume by 50% or 75% or 25%, and now you've also added on PPE cost? That's another whole factor in your cost of goods too. So I just we've had a lot of learnings on that part. Like, be mindful of what your costs are too during this time, and what's the best for you taking care of your patients and staff.
Yeah, I want to echo that also, if I can, Howard. And there are built-in inefficiencies now in our business, and because we have an extra half to full-time FTE just in sanitation, which you didn't have before. So you have to say, if I've got these extra inefficiencies, which have to be there, safety first, then how am I going to find other ways to be more efficient? Okay. And what's interesting is the 2 projections that we thought were, when we're trying to look at the business side as well as the patient care side, were, what will patient demand be? That's the hardest one to predict. We're starting to see the patient demand, at least short term, is really big. It may be pent-up demand, but it seems like it's the regular demand. Long term, I think things get back to normal. What's going to be interesting is the intermediate term, like in the fall, when we're now ramped up again, and now we get a second wave of Corona. How will that be? The other thing is, we're looking at, from the business side, what's the dollar per exam? Everybody should know their typical dollar per exam. We're actually seeing a higher dollar per exam now, despite not having insurance kicking in, because we've been effectively not filing insurance a lot for about a month. Now, in the next week, we'll start seeing some of that kick in, but it was a really interesting early look. And I think some of that was we were allowing people to extend their contact lens supplies for 3 months or 6 months, as long as we're making an appointment for them. And so we may be seeing extra dollars relative to the number of exams we're doing, but it's a safe way. Our doctors agreed, it's fair, we're still going to get them in. But all of these type of things kind of make us, in a time of crisis, it makes us rethink what is standard versus what is acceptable, what is good enough. All of those things are kind of spinning through all of our heads right now and saying, will things be the same as they were afterwards? And I can guarantee you they will not. And so the doctors that adjust and say, I can't keep doing the same things I was doing exactly the same way, because things are different now, they're gonna be behind. They've got to be thinking, I've got to have new systems for inside the office as well as out of the office to take care of the same patients as before.
Yeah, no, great perspective. Thank you. Eric, are you there with Dr. Davis? Can you hear us over there okay?
I'm here with Dr. Davis, and he's been briefed on the conversation. He's ready to speak on those topics.
All right, and the other thing, if he wouldn't mind speaking on, has he implemented any type of telehealth or remote type of engagements with his patients? Be interesting to hear from him on that subject as well.
You could add telehealth to those subjects.
Sure.
Questions to you, and they've spoken about those topics we were just talking about. And
Telehealth.
Review on telehealth and
Okay.
on volume and on dollar per exam.
Okay. Sure.
Hey there, Bob.
Go ahead.
All right. Well, okay. Well, we're 6 feet from each other, so I took my mask off. Basically, what we've done is reached out to our better patients. We call them our VIP patients. So we got on the phone and we actually called patients who come in every year, get a year's supply of contact lenses, for example, spend money on our optical. Those are our VIP patients. Of course, our macular degeneration patients, our glaucoma patients, we don't have as many slots now, so we wanted to fill those slots with those valuable patients. And they really appreciated the call, and we're doing that on a regular basis now. And that's how we're filling our slots, letting them know we're here, letting them know we're open. We are getting demand. Strangely enough, people want to come in, they want to get their eyes examined, so we're going to add more doctor hours as we go along. As far as telemedicine, we're doing things a little bit differently as far as that's concerned. Contact lens patients, for example, we're seeing them day one. We're dispensing their annual supply of lenses if we can on day one, and we're using telemedicine a week or two later to see how they're doing. We actually can see how the lenses are moving on the eye. We can see if the eye is red. We can communicate with the patient. These patients probably rather not come into the practice if they don't have to, and we can do that through telemedicine. We also can look at our dry eye patients using telemedicine as well. So I see telemedicine in the future. I don't think we're going to ever want to refract with telemedicine. I think refraction should be done in an office. And again, it's not going to take the place. It's not as good as person-to-person doctor visit, but it will have a place in the future. We try and give patients choices as far as coming into the practice to pick up glasses. They call, we don't let anybody in without an appointment. And if they prefer to wait in the car, we'll actually bring the glasses out to the patient in the car and dispense the glasses that way. So again, we're doing everything we can to make our patients more comfortable in this new normal.
Thank you, Bob. Appreciate that very much. Jeff, maybe you started talking about it earlier. You heard Bob mention something about telehealth and how he's implementing it in his practice. What are you guys doing at Cool Springs and some of your other locations to at least utilize it in some way, and how has that gone?
Yeah, I'll tell you, one of the positive outcomes of this is the insurance companies and the regulators kind of relaxing some of the tight standards around telehealth and saying, just take care of patients. And really, that's what we as doctors and healthcare leaders really want, is can we put the patient first? And so now with reasonable reimbursements and the ability to not be in such big violation if you don't, close the door and have all these HIPAA, basically we're Zooming like this, or we're FaceTiming when we have elderly patients that go, I don't know how to Zoom, it's like you've always provided emergency care by phone and prescribe if you felt, it's a doctor decision. Telehealth has been was bigger for a while and I think it will maintain. Anytime we can do telehealth, whether it's a doctor prescribing and taking care of red eyes, check eyes, contacts, other problems like that, that frees up a spot in the in-office schedule that improves our access for exams. Same thing with follow-ups like Bob's doing. Every time you take a contact lens follow-up patient off, if you can equivalently do that out of the office, you now have a spot for another exam. Those exams tend to generate more revenue than those follow-ups. And so maybe that's part of where we're seeing the dollars per exam. Where I see inefficiencies are, first of all, people have to know how to code. So we put a little course together for our doctors on correct coding. But where I see inefficiencies right now is that it's taken me as much time, if not more, to do telehealth because I'm doing this, talking to the patient. I don't want to be sitting at my computer or doing a manual form and then scanning it in. And so I basically am doing a little bit of paperwork while I'm taking care of them, do that, talk to the pharmacy or delegate that to my staff, and then I have to enter into the computer. If telehealth increases, I'll have to have a scribe with me there also. It's just inefficient any other way to be doing, a $40 to $60 reimbursement, or even in a big case, a higher reimbursement, but taking me a half an hour. That's just not effective use of the doctors. What we've also seen real quickly is that yesterday we said, are we still telling people we want to do telehealth as much? Because we're the safest thing is keep them out of the office. And the staff said, you don't realize the power of the white coat. We're offering it just like we were before, but now that they know we're open, they're saying, I really would rather come in the office. So I think they're getting more comfortable with being out, and that's just the society around here.
That's it's a good sign. We're going to hear from ARTIS in a second, but I was just saying it's a good sign. We're hearing from Sue that the demand is there, people wanting to come back. We're hearing from you, people wanting to shift over from a telehealth platform to seeing each other in person. And I can appreciate that since we've all been kind of cooped up for so long. ARTIS, perhaps you can tell us a little bit about what's going on. And you have a large network and a little bit different perhaps, but have you guys implemented any type of telehealth approach?
Yeah, we have, and I think that Dr. KEGARISE makes some good points. One of the things, though, that is specific to optometry really is the limitation in the available technology and the fact that we've lagged behind other healthcare professions when it comes to the development of that technology. That inefficiency of having to have a telehealth platform that's maybe built for optometry but not integrated, for example, into software systems, it does make it more complicated when it comes to being able to bill for things, to actually account for things. The business side of understanding what you did and how much you charge for it and the time it takes to do it gets lost with some of the software out there. That said, I do think that we have an extremely good opportunity now to develop and build some of those systems for the longer term. We found some of the same things. Patients wanted access when it was convenient for them to be able to diagnose, help them to fill in those gaps. But what we learned during the process is that we can redistribute our doctor time in office to be skewed towards those more productive moments with the patient and take some of these other things back out of the office. That has two really big effects. The first is that it's really convenient for patients, but the second really is long-term. We can structure templating for patients in a different way so that we can maintain social distancing and still, back to Sue's original point, be productive enough to watch the bottom line if we can develop these ways of utilizing telemedicine. And so what we've done is we've gone from the telephone consultation to being able to do to do synchronous views, like Dr. Davis was talking about. We've done asynchronous views, and we've also looked at other ways to interact with the patient in the office while using remote doctors or other individuals to interpret information. And all of those things, I think, are coming together to form what patients will begin to expect and experience as kind of the new normal in healthcare when it relates to optometry. But you've got to be in front of that. You can't be the also ran or the, well, we think we're going to do it now kind of group. You've really got to be thinking about, this has to be done now. These are the things I'm behind on. I got to catch up. And now I got to look at what the patients are going to want in the future so that I'm prepared in case, again, something like this happens in the fall or later.
All right. Yeah, please, Sue, go ahead.
Yeah, so, great insight on telehealth, but I just want us to be mindful as an industry, that is just one entry point of our total patient visit. When COVID hit us as a country and as an industry, we were behind because of three big reasons. We did not have proper PPE in our industry, and we had to secure that. Second, we have to continue to create awareness and get people to understand that we are a healthcare provider. We have to go away from the idolization that we're in a retail environment, that we are a true healthcare provider. And then the third thing is that telehealth, while it's sitting in the middle of the patient visit and is so important to the patient's outcomes, it's actually about the whole transformation of the patient's experience. Jeff, you said already, like your intake process to automate it has been a challenge for your practice. We have to take it away from being a traditional visit that we've known for so many years, and we have to really make it modernized. We have to digitalize it, and we have to make it where the patients can own their engagement with us and make it easier to do business, whether it's a mobile check-in and intake process, it's a mobile check-in to pick up their glasses, they're actually building their glasses online. And this is something we were working on prior to COVID, and we really had a solid work stream of focusing on that, because we think if we had been further along in that journey, we would have been able to continue through this process a lot different. So telehealth is really important is my point, but I just want to make sure we all focus as the industry coming together, because we have to transform the patient experience as we know it. We have to move forward like many other industries have.
So true. Absolutely, Sue. And I've always been impressed how you manage My Eye Doctor, you and your team. You've done such a great job. Perhaps as we start to wind down, maybe you could tell us a little bit about this one family fund that you started at My Eye Doctor.
Sure. So first of all, I just want to thank everybody at My Eye Doctor for participating. And not only at My Eye Doctor, we have so many colleagues and business friends and personal friends that have donated. So, sadly, we have over 6,600 employees, and we did have to furlough a lot of those employees. And so PJ, my husband, and myself, we actually started a one family fund where we put up an amount of money that has since been matched and exceeded. We're over $100,000. And we have been able during this time to give our associates who are furloughed, our associates that are making under a certain hourly rate, food cards. So we've been able to help 563 families, I think, this morning, and giving them another source of having food on their table during this absolutely horrific time that we're going through.
That's fantastic. I think anybody who knows you would not be surprised that you're doing this. You and your team are doing it, and I congratulate you for that. Jeff, let's a little aside for you. A little birdie told me somewhere along the way you and your wife are going to be publishing a book. Tell us about that.
Well, I appreciate you mentioning that. We're a relationship-based practice, not just in eye care, but in healthcare. And we've worked with a lot of physicians and other optometrists. And so we finally started with a service manual to say, this is what we do. And rather than oral history, put it down. And that's become a one patient at a time playbook. And that'll come out in June. So I think that will help reinforce our patients, what we're doing, what we try to do, but also with our staff. Hey, this is in print. You better make sure it happens each and every time now. So that'd be good. Yeah, I want to echo what I think that's great what Sue's doing. We have two goals in this whole process. The first one is safety. Hierarchy of service is safety at the bottom, then courtesy, then experience, then efficiency. And this is illustrated where we talk about that all the time. Now with COVID, it's like, oh yeah, safety is most important. So that's really important. That's number one for patients and staff. But number two, and I keep our staff focused on this, just like Sue and ARTIS, we have people that are still furloughed. And so it's kind of like Moses, I get my people back. I want all those people back and working and employed. And as soon as we start looking and going, hey, things are picking up, we're getting busy, I'm going to kind of cut the knees out a little bit and go, yes, but do we have everybody back on staff yet? No. So we have to continue to be thinking about those people who are scared and nervous and not as connected as we are to what's going on internally. So that communication is really, really important.
I'm glad you reemphasized that. So as we wind down here, I know that our listeners always like to hear what it is you guys may be reading or any recommendations you might have for them during this time. So we'll start with Sue. Sue, any recommendations you have? Something you're reading these days that might be beneficial for folks?
Yeah, so I'll give you two. Outside of all the COVID data and economic data we're getting, I'm really enjoying The $1 Trillion Coach right now. I think it's just amazing to read and hear the story of Billy Campbell and how he impacted so many lives and how to lead through coaching. And then one of my favorites that I've read in the last couple of years is The Founder's Mentality, which I think just might be really helpful to a lot of doctors, independent doctors, during this time period of thinking about their overall business and how they revamp.
Love The Founder's Mentality. Great book. I enjoyed it so much when I read it. Very relevant to all of us, whether you be in a big organization, smaller, it doesn't matter. Good stuff. Thank you so much, Sue. ARTIS, any recommendations for our listeners?
Yeah, we have read so many things about COVID, and then subsequently about all the things surrounding COVID. But when it comes to really thinking about how we interact with our patients differently and where we want to go business-wise, I really like "That's Not How We Do It Here" by John Carr. I think that's a great example of this is the way it was, but it can't be that way going forward. And it really helps to open up your thought process about what you want to look at differently and why it's okay to be different than you are today.
Thank you very much. Jeff, you get, I guess, the almost second to last one, I guess, but those are some good recommendations. Anything you can add to that list?
I have a few new that I'm reading. I tend to be one of those people that has like 6 books on your nightstand, and I go, yeah, I'm about halfway through this and a third through this, but I have I've consciously reread and focused on The Discipline of Market Leaders and Visionary Business by Mark Allen. But The Discipline of Market Leaders is really to emphasize to our staff what is our stake in the ground, where do we excel, and how do we build that patient relationship, customer intimacy, if you will, into a new standard of safety and a new standard of efficient care, because we can't lose sight of that.
Thank you so much. So before I kick it back over to Eric to get a final word out from the field and from Dr. Davis, I want to thank our 3 guests so much. This was a packed full of great information and actionable items from all of you. We thank you so much. I wish you all good luck as you continue to progress through these very uncharted waters. And it's because of leadership like the 3 of you show, as well as Dr. Davis, that we all continue to learn from each other and grow and develop. And, this is a close-knit optometric family, and we're seeing it in loud and clear, without a doubt, through this pandemic. So thanks to the 3 of you. Eric, we're going to kick it to you to have a last word from Dr. Davis. Let him tell us what he wants to leave us with and kick it over to something to think about. I also want to say before Eric takes it, next week we have a great show for you. So we have Neil Blumenthal from Warby Parker and Prateel Lau from Warby Parker, who heads their optometry side. And we'll look forward to hearing from them and a little bit of what's going on from their viewpoint. So Eric, turn it over to you. And thanks to Dr. Davis for spending some time with us today as well.
Howard.
Yeah, he's got you. Go ahead.
Howard, thank you for letting me do this for you. And it's nice to see some good friends. I have a book that I can recommend.
Please.
It's called Unleashing Excellence. It's the Disney experience. And what we did is had our staff who were on furlough actually do it on Audible. And then we had a Zoom conference with our staff and we discussed it. So we kept training the staff. We want to make the staff better. We want to make this positive. And when we get out of this, we're going to have a more positive experience for our patients and our staff. So again, thank you for having me and letting me do this. We appreciate it.
Bob, thank you so much. And thank you for letting us come into your office and disrupt things a little bit. And this crazy guy with his hat on, thank you for letting him come into your office as well. Eric, you get the final word and kick it over to something to think about.
Yeah, there's a lot to think about here, I would say, and I would love to mention. Stand by 1 second. I'd like to thank some of the production companies that are helping make this happen. And we've got Good Sport Media up in Darien, Connecticut. We've got Adam Kaplan, ASK Media in Boynton Beach, Florida, doing the live stream from here. All Things Media is mixing the whole show in Mahwah, New Jersey, and Visitivity Media and Machado Films are all working on a video program that we're going to call Welcome Back Your Practice. So stay tuned for a special report on that coming up, I think, about Sunday or Monday. But in the meantime, something to think about.
We find ourselves in unprecedented times where the mix of safety, finance, and fear are dominating all of our decisions. As you approach reopening, remember, many of you may feel totally prepared for this, something that just comes second nature, while others of you, maybe most, feel like you're lost, unprepared to be able to deal with the human capital and financial capital aspects of your decisions. It's okay. You've got to realize that there's not just one way to deal with this type of a situation. The only right way is what's right for you, your patients, and your office team. Keep in mind that this is not an event. This is a process. You need to use this time to listen, to learn, to try new things. You may even fail, and that's okay. Try them again until you succeed. Keep in mind that the very best minds in our business have dealt with this situation exactly as many times as you have, and that's none. This is your time to shine. You should always work to make sure that you strive for the very, very best outcome. You don't want to just survive, but you can thrive in this environment as well. I'm John Rimpakis, and that's something to think about.
Thanks for watching Inside Vision. To receive updates about our programming, click subscribe.